Welcome to RUMC Vital Signs. My name is Alex Lutz. On our show, you'll meet the fantastic people who make Richmond University Medical Center thrive. RUMC is an award-winning, full-service hospital located right here on Staten Island at 355 Bard Avenue. To learn more about the full array of services provided at RUMC, visit www.rumcsi.org. According to the New York City Department of Health, Staten Island has the second highest rate of overdose deaths per 100,000 residents in New York City, and nearly 1,000 people have died of opioid overdoses on Staten Island since 2016. Those caught up in the cycle of substance use disorder may feel lost with nowhere to turn, and the thought of seeking help, kicking their habit, or staying clean long-term generates feelings of fear, embarrassment, or worry that they will not be able to stay clean. Joining me today are Denise Nizzare and Nico. Both are peer advocates in the Peer Advocacy program at Richmond University Medical Center. Both Stephen and Denise are here to share with us more about the program and how they and their fellow advocates are, quite frankly, saving lives. Welcome to the show.
Thank you for having us.
Thank you.
Denise, maybe we'll start with you. What is a peer advocate and what is the Peer Advocacy program?
A peer advocate is somebody that uses their own lived experiences to help the patient or the person that's in front of them that's seeking help.
Mm-hmm.
And in the emergency room, we meet everyone bedside. We do bedside interventions with anyone that comes in with a substance issue.
Mm-hmm.
And we engage them in conversation. And if they accept our help, we provide them with support, emotional support, resources to detox, rehabs, meeting lists. I even meet them at meetings. I refer them to Silverstein. It's a really wonderful program. It's been in the ED, I think it's now 6 years.
Mm-hmm.
And in the last 5 years since I'm there, we have done thousands of bedside interventions,
Mm-hmm.
and a lot of them very successful.
And how many peer advocates do you have in the emergency room?
Right now, there's 3 of us.
Mm-hmm.
Hopefully, we'll get more because we need more help.
Okay.
It's getting very, very busy.
Is it?
It's getting very, very busy. I think part of it is because people know that we're there.
Mm-hmm.
So they actually walk in asking for the women in purple. That's why we wear purple.
Okay.
And it's a great program, and I'm thrilled to be a part of it.
So how do you first interact with someone that might be a candidate for the program?
Well, first I read their chart.
Mm-hmm.
I realize why they're here. And then I tell my truth. I walk in, I introduce myself as Denise, and I'm a woman in long-term recovery, and I am your peer advocate. Would you like to talk to me about what's going on today? And usually the answer is always yes.
Really?
Well, they know that they're not being judged. They're not being made to feel ashamed. I'm there telling them, I've been where you're at. Please let me help you. And the whole staff wants to help you. The doctors, the nurses, the MAs, we all work as a team. And then they open up. And for those that are ready to make a decision, we try to get them out of the ER as soon as possible to a detox or a rehab. For those that are in a contemplative stage, they still don't know, they're not sure, everyone leaves with a packet of resources and our phone numbers. And everyone also gets trained in Narcan.
I guess that's why I said really I would just naturally think that someone who is addicted may just shrug off, the idea of assistance, and that's why I guess I was a little surprised to hear that most people actually say yes. I would think you'd encounter more hesitancy than willingness to be helped.
It has gotten so bad in the last few years, especially on Staten Island, that people are actually walking in asking for the help. Like they're not lying about what they're using. They are walking in saying, I did this, I need help with this. And when they hear that a lot of us are in recovery, I think that breaks down a very big barrier for them. So they know, I've been where you're at. I'm not going to judge you. I'm here to lift you up and help you. And I'll show you what I did, and I'll help you along the process. And it's been working beautifully.
So in your situation in the emergency room, it's not just people who are being brought in by ambulance. They're literally walking into the lobby being like, I need help.
Right. We also do a lot of case finding. So we're on the Meditech system, and we look for certain things. Past visits, flank pain, stomach issues, bleeding ulcers, all would be associated with alcoholism. And then for the drugs, for the opiates, and the heroin, we look for other things. And we find a lot of people that are in the ER for a completely different issue, but we engage them anyway. And we help a lot of them. Again, when they find out that we're in recovery and we're just there to help them get whatever they need, and sometimes it's just a pillow and a blanket.
Wow. And now, Stephen, you're over at the Center for Integrative Behavioral Medicine. So you're running programs of people who also need assistance.
Yeah.
Are you also seeing people like walk into 1130 South Avenue saying, I need help, or is it mostly referral?
A lot of them are referral, but it's not out of the realm of impossible to see it a few times a year, somebody coming in and saying, listen, I'm really in a bad way here. And I would talk to them and say, okay, well, first off, tell me what's going on, and we could start from there. And I've had a few people say, well, you know, I need help. Can I join your program? And I would say, no, you don't join. You could become a part of our program. And what we'll do is once we get you set up where you meet the doctor and the nurse practitioner, clinical staff, get you a good therapist, then I can meet with your therapist and decide how we can help you take your life back, take control of your life. Okay, because much like what Denise said, it's non-judgmental, and I get that. So what I do is I offer my experience in life, and I'll tell them, listen, I get it. I know where you are. I kind of understand that. And if I can do this, you could do this. And it's just a slow step. And that's what I do. I like to give them options because I think options are so important for them. Unfortunately, you have so many that are scared to take that step because they're so dependent on the drug or the alcohol. And I get it. They get nervous, you know, and they think that, how am I going to live on life's terms? But I kind of tell them it's so easy. And it's such a beautiful gift to have recovery. You just have to trust in yourself first, and everything else will fall into place. So if I see somebody who's struggling, I kind of want to be there for that person and let them know, hey, you didn't come to the wrong place. You actually came to the right place, and we can help you get on that right road. If that's how serious you are, and then we can help you.
And are you doing it individually or do it in group?
I co-facilitate groups, but I have done it individually as well. But I also co-facilitate my group. So if there is a group I'm doing and somebody starts really expressing themselves, what I'll do is I'll pull them out, pull them with me in my office and say, hey, something's going on, I see it, okay, and I'm here for you, and you have to know that. I'm here for you. We are here for you, okay, and we want to help you. And I'm glad that you were honest. You could let your emotions out, because now it makes this transition a little more smoother when you're honest like that.
Right.
So that's what I tell them.
You know, it kind of reminds you how you were saying how it's non-judgmental. A couple of episodes ago, we had on the nurses from our sexual assault unit, and they were adamant that the most important thing to convey from the very beginning is, we believe you. And in this instance, we're here to help you. We understand where you're coming from. Building that trust has got to be like probably the foundation. That's where you guys have to start, right?
Exactly. That is the foundation.
And I'm sure Denise would agree, you know, being in full-blown addiction, there are severe trust issues where they look at us as the person they're afraid to become.
Right.
So we break down that barrier little by little by little, and trust, again, is probably the most important thing, because they see where we come from in our roles as peers and what we're about, and they kind of latch on to that. I've seen it where they're like, you know what, maybe this isn't such a bad idea. Maybe this is the right place I need to be. And they'll hear other success stories, and I see that they want it, and I tell them, listen, you don't have to look dejected. You know, it's here for you. You can do this. Right. Just believe in yourself and trust the process of recovery, and this is going to go fine for you.
And do you, in addition to working with the person themselves, do you work with the families as well?
If the patient gives me permission to speak to their family, I have no problem doing that, especially when it's a young person. But yes, I'll work with the families. I always suggest the families to go to meetings of Al-Anon, to go to therapy themselves, because the people that live with the alcoholic and the addict get just as sick as the active person as well. So we need to treat the whole family. So we start with the individual, and if he gives permission or she gives permission to speak with the family, we absolutely do.
And is there like an end to this program, or is it a continual involvement in the program? Or does someone finally just say, I've reached a point where I don't need to do this anymore?
There's never an ending to recovery.
Never.
Never. People have said, I'm done with the program, and then they'll go on about their lives and attend meetings. I've seen that. We always encourage our clients to keep coming back. That's why we're here. Keep coming back. Even when they leave, we'll tell them, if you need us, if you need to talk, here is my number. Don't think that the doors are closed, you know? You have options, and you will always have options. So we like to let them know that when they feel that they're done, that they have other options to come back if they so choose to. And that there's always some dialogue that can go on.
And your program based out of the center, you have more long-term interaction.
Oh, yeah.
Denise, do you have that as well? Or once they leave the ED, it's kind of a handoff to Stephen and his team?
It depends. We always do follow-ups with all of our patients. We stay in touch with the ones that do recover and complete detox, rehab. We always refer to Silverstein if that's available for that individual, because it really is a very well-run program. And we do follow up and stay connected. The ones that actually get it, like get the program, want to stay connected to us. And I attend meetings myself, and nothing brings me more joy than when I walk into a meeting and I see someone that I met a few months ago in the emergency room, and they're smiling and they're laughing and they have this whole brand new life. It's the greatest feeling in the world.
You mentioned Silverstein Clinic. Can you talk a little bit about what Silverstein Clinic is?
Sure, I'll leave that to Steve.
Good.
It's an outpatient treatment facility located, as you know, on Staten Island. It's at 1130 South Avenue. We're on the second floor. And it's a substance abuse program, primarily substance abuse program. Of course, the facility has other avenues that they can explore for mental health, the Center for Young Adults, Safety Net. But what we do primarily is work with people in substance abuse. And we get them set up with their doctor, the nurse practitioner, and a therapist. And again, they can engage in groups, they can do individual sessions. You know, it's pretty much what makes them feel good for the day. If they don't want to go group option and they want to just do one-to-one, face-to-face, then we can do that. They'll meet with their therapist, and then they'll meet with me afterwards. Or if they want to meet with a group and network with other peers in their community, then that's what they do as well too. You know, we do offer medications that they would have to speak to the nurse or the doctor for if they feel that they need it. And that's, you know, pretty much the nuts and bolts of it.
And I think you pointed out, you just touched on something that I think is something that's important is, you know, when you're treating addiction, you have to treat the body. There's so many health issues related to the addiction that we've heard from past guests that we've had on, and just doing some research for today's show, that people suffering from substance use disorder tend to neglect their own health. And having that ability right there at the clinic to have a physical, see a doctor, see a nurse is fantastic.
It's the first step to getting them on the road to recovery. It's not only outward, but it's inside as well, inwards as well.
Right.
So that's where it would begin right there. And it gives them a sense of purpose, a sense of motivation. You know, I tell people all the time, aren't you excited you're getting to see the doctor today? You know, how do you feel about that? You know, and they're like, that's great. I haven't seen a doctor in 8 months, a year, 2 years, or whatever. And I tell them, see, small steps, and you can do this. And they like the encouragement because they see that our program encourages them to be who they were supposed to be. I say the real you, the true you, the you before the disease, which is just dormant. And you can bring him or her back again by just following these simple steps.
And how long have you been involved in Pure Advocacy?
7 years.
And Stephen, how long for you?
About 7 years.
Okay, so about together. So in your time that you've been involved in this field, what have you seen? I mean, is there trends that you're seeing? Is addiction affecting certain age groups, demographic? Is it just everywhere? I mean, we talk about this kind of unspoken pandemic here on the island of opioid and substance use. What have you seen trends in your experience?
I'm seeing the rate of alcoholism go through the roof. You know, our numbers this year, just for alcohol alone, are astounding. It doesn't matter your age, your race, your ethnic background. Addiction does not discriminate. And I think a lot of people are feeling, you know, stressed out, angry, fearful, and they're using substances to cope. People that have never, ever drank or did drugs before are suddenly getting addicted to prescription medication or relying on that 2 glasses of wine at the end of the night, and then they're walking in saying, I don't know how I got here in this place. That's what I'm seeing.
Yeah. I see a lot of marijuana use now in younger kids, a lot.
Yeah.
So much more than I did, honestly, before COVID.
When you say younger, about what about it?
14, 13.
And do you think that's peer pressure, or it's just now the availability of it?
I think it's a combination of both. I think it's a combination of, what their friends are doing, hence peer pressure. And I also believe that there is this, from what I've seen, a lot of our younger, patients, clients that come there, it's kind of like they want to break away from their parents already, and they're trying to show a sense of independence, so they're going to do what they want to do. Okay, yeah, I would have to say marijuana, and obviously Denise hit on it as well, alcohol too. That's also something that I'm seeing a lot of now. Younger women, younger men. I'd say between 15 to 18. It's a scary trend, and that's why we're there to kind of say, okay, let's work past the boundaries, because I see that you have boundaries here. I see that you have barriers here, and let's try and get through those barriers one at a time. Okay, because you're not drinking because you think it's cool. Okay, you're drinking because there's something in you that you don't want to talk about, or you're afraid to share because you feel you're going to be judged. And there's nothing to do with being judged. And again, back to peer pressure, I see it all the time, all the time.
Do you approach someone who is having issues with alcohol, prescription medication, marijuana? Do you approach those addictions differently, or is it's the same approach regardless of the particular substance?
Addiction.
Same approach.
Same approach. And I just want to make mention that at Silverstein, the Center for Young Adults is a fabulous program, that really treats this younger population in a very, very special way. And I just wanted to, make mention of that, because they do an amazing job. I've sent several young children there, and they're all doing great today.
And Stephen, you and I have spoken, many times, and you have a phrase that has always kind of stuck with me, where you say the peer advocates are a bridge between a counselor and a sponsor. Can you elaborate on that a little bit?
Yeah, sure. My role as a peer is, once somebody gets set up with the therapist, and if they meet with their therapist, I in turn will go to the therapist if I know I'm going to be meeting with him or her, and I'd say, okay, this is what I got out of speaking with the client today. Because as peers, we have to really let their primary therapist know what's going on. At least that's how I feel, since they are clinical, more or less. So I will let them know, hey, listen, I spoke with so-and-so said this, or wants to act out on this. And what I can do is I can actually get linked up with their sponsor as well and say, hey, listen, how's he or she doing? What's going on? Are they attending your meetings, attending the groups? Are they verbal? Do you see certain things that maybe you should tell me so I can address the person with, and I can let their therapist know? Because at the end of the day, Alex, it's about getting that person right. And, we do what it takes to help them get right. And they kind of know that at the end. They get the idea that they're very thankful and appreciative of the work we do. So, I just have this thing where we can actually speak to both. We are the go-between. And I would say to them, if something's bothering you, did you share it in a meeting? How does your sponsor feel about it? Come to me, and they'll tell me, and then I will let the therapist know, listen, I think maybe we should talk to him so-and-so about what's going on right now. Something was brought to my attention. I didn't like what I heard, so maybe we can approach it from a different angle.
So both of you have kind of alluded that you speak to the people in the program pretty frequently. So it's not uncommon to have a conversation at 2, 3 in the morning with someone that's struggling, someone that needs help.
Not uncommon at all.
No, no. I've gotten calls, and sometimes just hearing our voices really changes somebody's trajectory at that moment. what they were thinking, and then when they hear what we say, they will be appreciative of it.
Right.
Because at the end of the day, where they feel nobody cares about them, we as peers, we do actually care about the people we talk to, because you know, it's like I say, we're not lifesavers. That's the doctor's job. We're life healers, and that's what we do.
Got away with a phrase, man.
Yeah, I try. I try, Alex.
So, I mean, you mentioned it earlier. When you meet someone on the street that you know is, I'll say, recovered because of your, I mean, that's got to be a fantastic feeling. I mean, can you share some stories or some particular, you know,
Ladies
obviously
first.
keeping some privacy, but just some of the
Sure.
success stories you guys have had?
Yeah, just recently, you know, we had a woman that was coming to us quite frequently, but just couldn't make the decision to go to detox. And just 2 weeks ago, she sent us a text to both Dorothy Hill, who's one of my peers, and myself. On a Sunday evening, I finally decided to listen to my ladies. My bag is packed, and I'm going to detox in the morning. And then she called us when she got out and on her way to rehab. And phone calls like that, it's just so important that you never give up. You never give up on someone. They may not hear the message the first time or the second time, but they do hear it. They do hear it. And it's just beautiful to watch people get their lives back. And the most important message that I'd like to convey is not only is recovery possible, but you'll never want to live any other way. It's just a beautiful way to live.
Wow.
And there's hope. There's so many people that want to help.
Steve, what about you?
I think one of the best success stories, and I've seen a few, but we had, obviously, we had somebody come to our clinic who was really struggling with alcohol for many, many, many years. Lost his 2 daughters. He couldn't see them anymore. Legal battles, court battles, and whatnot. And he was hospitalized many times, gout, liver problems, just couldn't get it right. We spoke. This was going on for over a year. Him and I were just going back and forth. And, you know, he calls me up at work one day and says, I'm done. And I said, okay, let's make this happen. Well, let's fast forward almost 3 years later. He's doing wonderful. He's back in college, studying computer science, has his kids, almost 3 years later, and he's so appreciative of the fact that he accepted the gift of recovery. And, you know, he'll always say to me, you know, thank you. I said, don't thank me. It's not me. You wanted it. I just pointed you in the direction where you needed to go. And he's very, very active in his AA meetings. He goes to groups. He comes to our clinic, you know, and he was a wonderful success story, you know, and I'm very glad for that. And, you know, just one of the many, you know, we've had many.
Yeah, we have a
It's just
lot
nice
of
to hear it.
success.
Yeah.
It's great.
Well, Denise, what made you become a peer advocate? Why did you want to become a peer advocate?
You know, I grew up here on Staten Island, and I have 2 children, 32 and 30, and I watched my friends bury a lot of their kids from the opioid crisis. And I was in recovery quite some time. I owned a yoga studio on Page Avenue, and I had a bench outside my studio. And I broke my anonymity right away. If you have anybody that's in trouble, you leave them on my bench. And so I've been doing peer work way before I became a certified peer.
Okay.
And why did I do it? Because I just want to give back what was so freely given to me. When I asked for help 23 years ago, the help came.
So you're 23 years.
23 years in September.
Way to go. Congratulations.
Yeah. Thank you. And that's why. And it's more than just a job for me. It's a personal passion to share the gift that I was so freely given. And I love it. I love what I do. I wouldn't want to do anything else.
Steve, what about you?
I guess for me, it started with the art of de-escalation, and then it kind of metamorphosed from there. I had been working at RUMC in security, which I know I was in CPAP.
Yes.
And I would see a lot of people come in, all different reasons and whatever, and I would talk with them, and I felt like I was giving back a little bit as well, too. And that was a joy for me to want to do that. And it was actually, at the time, one of the techs, who later went on to be a nurse, showed me that, hey, you should do this. And I jumped in head first, and I did what I had to do. And, you know, I just enjoy giving back. You know, I feel I tell people I love my job. I tell people I have the best job on Staten Island. And I have no reason to complain about the line of work I do or how I go about doing it or where I do it because I enjoy what I do. And I tell them the same thing. If I can enjoy everything that I'm doing, you can enjoy everything that you're doing without any boundaries, without anything to stop you. It's you and your recovery. And you know, like I said, Alex, it was just something I felt I wanted to do and just give back from where I came from to where I am now. And it's just, it's awesome what I do. That's
But your
the way I look at
passion
it.
for what you do clearly comes in how your body language, you're smiling, you're talking. So what I want to do in the closing minutes is, you know, if I'll give each of you an opportunity to, if someone's going to watch this episode or see this who is in substance use or has a family member or a friend, what would you want to say to them? What would you want them to know?
Please just ask for help. Everybody wants to help you. Your family, come to RUMC, walk into the ED, ask for a peer advocate, call Silverstein, and they could also call the 988, you know, suicide substance abuse hotline for help. There's so much help out there. That's what I would tell them to do.
Stephen?
Same thing.
Yeah.
Don't talk about it, be about it. Let's go. Let's do this. You know you want this. Deep down, you are the person you were supposed to be, right? Maybe with a little guidance, we can get you going, and I'm here to help guide you. If you need avenues to go, I will show you those avenues that we take. Just be honest with yourself first, because that right there, that's 50% of it. The honesty with yourself. Everything there after that it's doable. I tell people recovery is believable, achievable, obtainable, and doable. You can, and you will. You can definitely do this with no problems.
I certainly hope that someone who watches this episode takes you up
Thank you.
on these offers.
We would love that.
Yeah, absolutely.
Well, I want to thank you both for being guests on today's episode.
Thank you, Alex.
I want to thank Denise and Stephen for joining me today, and thank you for all the difference that you're making for everyone here on Staten Island for what you do, and congratulations on 23 years.
Thank
Thank
you
you.
very much.
If you're in need of assistance or would like to learn more about the Peer Advocacy Program, you can contact Stephen at the Silverstein Clinic at 718-818-6970 or Denise in our emergency department at 718-448-9775, extension 235. Richmond University Medical Center has cared for Staten Island and the New York City metropolitan area for nearly 120 years. You can help ensure that that care continues by making a financial contribution to the hospital. Donations can be made in your name, the name of a loved one, or to honor a special nurse or doctor at Richmond University Medical Center. To donate, visit our website at rumcsi.org and click on the donate button located at the top of the homepage, or you can call 718-818-2106. That just about does it for this episode of RUMC Vital Signs. Thanks again for joining us. I'm Alex Lutz.